The complex and life-saving transplant journey begins with a generous donor and ends with a grateful recipient. This process is patient-centered and focused on providing equitable access to life-saving care. United Network for Organ Sharing, or UNOS, is the engine that powers the National Donation and Transplant System, and it maintains the National Organ Transplant Waitlist. Only the dedicated team of professionals at a transplant hospital can place a patient on that list. First, the patient undergoes a series of health evaluations. Through this process, the medical team determines whether the person is a good candidate and whether it's likely the transplant will be successful. If so, then their name and medical information are added to the national wait list. Despite what we see in pop culture, a patient is not assigned a number to wait in line. The wait list we often hear about is more like a pool of candidates. Organs become available when a hospital patient on a ventilator gives the gift of life through donation. Once an organ becomes available, an organ procurement organization, or OPO, uses the UNOS computer system to generate a list of best-fit candidates based on different medical and logistical factors. The potential recipients of a donor organ are ranked according to different medical criteria, like blood type, body size, how sick they are, distance from the patient hospital to the donor hospital, and how long they've been on the wait list. Once an organ has been offered to a patient's transplant hospital, they have a limited time to accept or decline. Clinicians, often working together with the patient, consider many things before making this important decision. No patient is ever forced to accept an organ. When an organ is accepted and recovered from the generous donor, the OPO is responsible for making sure that organ gets to the transplant hospital and that the right organ gets to the right patient at the right time. Every patient's recovery will be different, but there will be significant changes, like lifelong medications. Throughout the transplant journey, from the wait list to surgery, from recovery to long-term support, the patient and their team remain partners in care, honoring this precious gift of life.